Social Security, I don't have a plan. I don't think anybody does. I think it's a very.
How do we get one?
I think the way you get one is the better question. There are lots of things that we could do. I mean, one thing that I think clearly ought to be on the table is lifting the limit. What is it, about $90,000 now of income? Either lifting the limit or creating a bubble above that to protect some middle income, and then lifting the limit. Am I making sense? In other words, go from 90 to say 150,000, where you have a bubble where you don't tax, and then above 250 you pick up the tax again. That also is a possibility. But that's an example of a tool that we could use on Social Security. But I think what has to happen is we need a truly nonpartisan committee to make recommendations that are achievable. And because even if it's partisan politicians from Democrats and Republicans, you're going to run into the same problem. And I think there are things we can do on Medicare immediately, using the power of the government to negotiate better prices, including prices for prescription drugs, much better coordination of services, preventative care. This universal health care plan, if implemented, would have a direct impact on the cost of Medicare because it's a birth-to-death health care plan. So both preventative medicine and not having people get to the place that they're catastrophically sick reduces. There's a huge cost containment to my universal health care plan, and it has an impact as a result on Medicare when Medicare picks people up in the system. So, I mean, those are things we can do with Medicare right now. Social Security is harder. We've got more time, but Social Security is tougher.